Tell me about the words diverticulosis and diverticulitis. Where are they and what do they mean?
So it's interesting, those two words are probably the most commonly confused words that I deal with when I see patients in practice every day. Diverticulosis is an anatomic term that simply means pockets forming in the wall of the colon. So they are typically in the lower part of your abdominal cavity in your colon, most commonly on the left-hand side of your colon. And if you got up real close to the colon wall to see it, maybe at a microscopic level, what you'd realize when you see one of these pockets is that it's essentially a herniation or a bowing of the colon tissue through the wall so that you form this pocket essentially. And many pockets will typically form over a section of the colon.
Does everybody have them?
Lots of people have them. They're very common. The data suggests that 20% of people over the age of 40 will have them, but by the time we look at people over the age of 60, up to 60% of people will have them.
Wow. So it's an outpouching, a bubbling out. About how big are they?
They're typically maybe a quarter to a half an inch big.
So do they cause problems?
Usually not. Majority of people with diverticulosis will form these pockets. They won't be aware of them. They might be picked up incidentally during a colonoscopy exam for screening or maybe on a CT scan done for other reasons. The times where people become aware of them clinically are if they develop complications from diverticulosis, and that's where the term diverticulitis comes in. Itis of anything, as you know, is inflammation of that thing. So diverticulitis is inflammation of a diverticulum, which usually occurs at a single pocket.
So when you have diverticulitis, it's usually one of those little outpouchings, even though you've got several of them. So you don't have diverticulitis of 10 or 15 of them.
That's correct.
At the same time.
That's correct.
Why do they become infected?
So it's controversial, actually. We used to think a long time ago that these pockets would sometimes collect stool debris, sometimes seeds, nuts, popcorn. That's a myth that's been propagated for a long time. And then you would get an abrasion at the dome of that diverticulum. That wall of that diverticulum is very thin, and then that would allow a hole to form and then contents within the colon to go outside, which then causes an inflammatory reaction.
So those can pop. They can make it where what's inside the colon goes into the abdomen?
Correct, usually through a very microscopic hole.
And so it sets up an inflammatory reaction that we call diverticulitis.
Diverticulitis.